11. Amazing benefits of ginger you never knew. Given its anti-inflammatory, anti-nausea and other qualities, ginger could offer several health advantages. Among other things, it could help you control arthritis, decrease weight, lessen menstruation pain, and more. From a blooming plant found in Southeast Asia, ginger comes. It contains a spectrum of health advantages and enhances taste in sweet and savory dishes. Closely linked to turmeric, cardamom and galangal, it is a member of the Zingiberaceae family. Usually used as a spice, the rhizome, the subterranean section of the stem, is usually referred to as ginger root or just ginger. It uses fresh, dried, powdered ginger as well as an oil or juice. It appears in various dishes as well as processed meals, home cures and cosmetics. 11 health advantages of ginger. Scientific study supports the following 11 health advantages of ginger. 1. Features gingerol, a really powerful therapeutic ingredient. Various forms of traditional and alternative medicine have long included ginger in usage. Among its several uses are those of digestion aid, nausea reduction, flu and common cold fighting, and so on. Natural oils, the most crucial of which is gingerol, cause the distinct taste and scent of ginger. The principal bioactive ingredient in ginger is gingerol. It is behind many of ginger's therapeutic qualities. Studies on gingerol find strong anti-inflammatory and antioxidant properties. It might help lower oxidative stress, for example, which comes from too many free radicals in the body. 2. Can cure other kinds of nausea, including morning sickness. Ginger might help with nausea, especially morning sickness, commonly known as pregnancy-related nausea. For those having some kinds of surgery, ginger could aid with nausea and vomiting. It also may help with chemotherapy-related nausea. Although typically safe, if you are pregnant, you should consult a doctor before consuming significant quantities. For those near labor and those who have experienced pregnancy loss or vaginal bleeding, ginger might not be appropriate. Those with clotting problems could also find it inappropriate. 3. Might support weight loss. Studies on humans and animals suggest ginger might help with weight loss. According to one 2019 study, among those with overweight or obesity, ginger supplements notably lowered body weight, the waist-hip ratio, and the hip ratio. Given specific processes, such as ability to lower inflammation, ginger's capacity to affect weight loss could be explained. 4. May assist with osteoarthritis. Osteoarthritis, OA, results from joint deterioration causing symptoms including joint pain and stiffness. According to one review, ginger might aid with pain and impairment. Depending on the study, the volunteers took 0.5 to 1 gram of ginger daily for 12 weeks. Their diagnosis was OA of the knee, most of them. Other studies, meantime, have not shown the same results. Many stopped treatment, though, because they disliked the flavor of ginger or because it caused gastrointestinal problems. 5. May reduce blood sugar and lessen risk factors for heart disease. Certain studies point to ginger's anti-diabetic qualities. According to 2015 research, 41 type 2 diabetists consumed 2 grams of ginger powder daily. After using ginger pills, fasting blood sugar and HbA1c dropped significantly in persons with type 2 diabetes, according to a 2022 review. 10 studies worth of data were examined in the review. Subjects consumed 1,200 to 3,000 millimoles daily for 8 to 13 years. The findings did not imply any change in the lipid profile depending on ginger supplementation. high apolipoprotein B apolipoprotein AI ratio and high amounts of malondialdehyde MDA might follow from oxidative stress, a side effect of oxidative stress. Both of them constitute risk factors for heart disease. Still, this was only one small study. More study is required to validate these findings. While the researchers did not draw any conclusions regarding fasting blood sugar levels, a 2019 analysis also revealed evidence that ginger can lower HbA1c in those with type 2 diabetes. 6. Can assist with treating persistent dyspepsia. By accelerating food passing the stomach, ginger could help control indigestion. Indigestion, with symptoms including stomach pain, bloating, feeling too full, burp, and nausea, for no obvious cause, is known as functional dyspepsia. Often associated with irritable bowel syndrome, IBS, in one study, participants with functional dyspepsia had much better symptoms of indigestion when they ate a ginger and artichoke dish before a large meal than when they skipped this step. 7. May lessen menstruation discomfort. Menstrual pain, sometimes known as dysmenorrhea, may be relieved by ginger. According to some studies, ginger seems to be just as good as acetaminophen, caffeine/ibuprofen, Novofen in easing menstruation discomfort. More research is needed though. 8. Might help reduce cholesterol. Elevated risk of heart disease has been associated with high levels of harmful LDL cholesterol. While raising HDL cholesterol, in a 2022 assessment of 26 trials, researchers discovered that ginger eating dramatically lowered triglycerides and LDL cholesterol. Effective levels even fell to 1,500 milligrams daily. Including such large dosages of ginger in your diet could be challenging though, especially if you find the taste objectionable. 9. Might help lower the cancer risk. Because of gingerol and several other antioxidant and anti-inflammatory agents, ginger may have anti-cancer effects. These substances have some proof of helping lower the risk of gastrointestinal malignancies, including liver, pancreatic, and colorectal cancer. In one study, 20 high-risk of colon cancer patients consumed 2 grams of ginger every day for 28 days. The participants' intestinal lining shown less cancer-like alterations at the end of the trial than predicted. Still, most research on ginger and cancer risk has not included people. 10. Might boost brain capacity and guard against Alzheimer's illness. Certain studies point to ginger's components, 6-shogol and 6-gingerol, perhaps helping to prevent degenerative disorders including multiple sclerosis, Parkinson's disease, and Alzheimer's. Age-related cognitive decline and Alzheimer's disease may be driven in great part by oxidative stress and chronic inflammation. Certain animal research point to the antioxidants and bioactive elements in ginger as able to stop brain inflammatory reactions. This could help stop cognitive drop. 11. Could assist in fighting infections. Given its antibacterial qualities, ginger might be helpful in combat of bacterial and fungal illnesses. Laboratory research suggests it might be useful against Staphylococcus aureus, S. aureus, behind a spectrum of disorders, Escherichia coli, E. coli, the agent causing stomach problems, Candida albicans, C. albicans, the fungus causing oral, vaginal, and so on infections. How to including ginger into your diet. You can include ginger into your diet by adjusting what you eat and drink. These dishes are worth trying. Chicken with ginger, garlicky ginger chicken with mint and cilantro, fiery orange. Ginger chicken and lemon. Ginger chicken, fresh ginger, tea, root tea from ginger. Malian, ginger juice. Danger and side consequences. Most people are safe consuming ginger in moderation. Large doses, however, can produce in some individuals the following symptoms: stomach trouble, diarrhea, heartburn, throat and mouth inflammation. Although it is probably safe during pregnancy and nursing, first it is advisable to consult a medical practitioner. Commonly asked inquiries. In what 5 ways may ginger improve health? Ginger boasts several putative health advantages. It might assist, for example, control weight loss, ease nausea, lower cholesterol, preserve nerve function, and lessen cancer risk. Ginger contains what vitamin? 1 teaspoon of raw ginger boasts 0.1 milligrams mg of vitamin C. It also has minute levels of magnesium, calcium, and other minerals. For whom should one avoid ginger? Generally speaking, ginger is probably safe for most people to use moderately. Although there is no proof it is dangerous to use while nursing or during pregnancy, it is advisable to first consult with a healthcare provider. The ultimate truth. Nutrients and bioactive elements in ginger could help your body and brain in different ways. It could help control nausea, stop infections, lower cancer risk, and more generally manage symptoms. More studies, meanwhile, are required to verify that ginger has these advantages. This video is for reference only. If you are considering adding ginger to your diet, you should speak with a doctor or dietitian for advice. If you found this video helpful, please don't forget to like, share, and subscribe to our channel to stay updated with our latest health tips. Thank you for watching, and we'll see you in the next video.